Today we're diving into a topic that affects a lot more men than you might think: erectile dysfunction, or ED. It is estimated that between 30 to 50 million men in the US struggle with ED. And yes, that includes younger men too. I'm Dr. Nazanin Moali, clinical psychologist and certified sex therapist. We all heard about ED pills. They can be helpful, but they're not the only option out there. In fact, there are so many other effective strategies that are pill-free that you might consider. First thing that you want to do is assessment. This is a step that many people not take seriously. Assessment is really important because it helps you to see where do you need to address the issue. Is the issue physiological, psychological, or relational? One of the ways that you can do the assessment, of course, going to your urologist or your physician, doing blood tests, blood pressure tests. They sometimes do ultrasound, injection, all sorts of things. That's the best way of doing assessment. And if for any reason you rather start the assessment at home, this is what I recommend. This is tech ring from FirmTech. This is something that you wear at night, and it's like a Fitbit for your dick. The way it works is that it tracks your nocturnal erection. In order for you to have healthy erection, you need to make sure your blood flow is okay. And one of the best way is kind of like assessing for nocturnal erection. Then when you have the data and you know that, okay, this is not physiological, the next great treatment is sex therapy. This is an approach that many people are not considering, but this can be life-changing for you. Not only because I'm a sex therapist, but I see it all the time from clients and our listeners that with just few sessions of sex therapy, people can learn strategies to change their mindset, regulate their emotion, because we know stress, anxiety, all sorts of kind of depressive factors in life, those can impact our quality of our erection. So when you go to a sex therapist, they do a comprehensive assessment of what might not work for you. And based on those assessments, they give you the right tools and strategies like breathing exercises, conversation you can have with your partner. So sex therapy is a great option for treatment. Next, we have vacuums. Vacuums are tools that are non-surgical, something you can buy online. It helps you to get an erection right before having intercourse with your partner. The downside is some people say it's kind of might feel awkward first few times that you're introducing it, but it can help you with getting a consistent erection. But oftentimes it does not resolve the issue, so it's not a cure. Next treatment is injection. So after going to your urologist, maybe you do assessment and you decide that medication is not effective for you, or you rather to use something that's more straightforward. With injection, it's something that you inject to your penis. The needle is small, and it's based on what I'm hearing, it's not as painful, but it can help you to have consistent erection with your partner. Many of my clients, they love it. And lastly, we have penile implant. These are the implants that you put through surgery, and it can help you to be able to get a firm erection even post cancer treatment, or even if you had any kind of injury. That's the option for many men, and it helps them to build confidence and get erection, even if that's something that they haven't experienced for many years. If you are interested to identify what you need to do, what are the first few steps for you, I developed this free quiz that teaches you exactly what you need to do to tackle this issue. The link is below this video. All right, let me know what you guys think. What other strategies you have used to manage erectile dysfunction.